Hi, Adriana.
Hi, yes.
Hi, I'm Dr. Champagne. Nice to meet you.
Nice to meet you.
So tell me a little bit about what brings you in today. What can I help you with?
Well, I used to have pretty nice eyebrows, but plucking, I was just over plucking throughout the years, and then I stopped plucking for a while, and then I went to threading. I don't want anything too crazy.
Okay, all right.
But I do want there to be less gaps.
Okay, good.
In my eyebrows, so if I didn't need to fill in my brows, I don't have to.
Okay. So, do you have any history of hair loss at all? Have you lost hair on your head or in the eyebrows, like not with plucking, but just notice that it's thinning or anything like that?
Just my scalp, hair fall.
Okay, like a normal amount though, nothing where you're noticing any significant hair loss or anything.
A little bit.
A little bit.
But I don't know if that's normal.
Okay.
Or anything like that.
Okay. Well, I'll take a look at your scalp. We normally lose about 100 hairs per day just washing in the shower. You may notice some hairs falling or on the pillow. About 100 hairs a day will fall on average naturally. So if it's about that, that's pretty normal. Looking at your hair, just looking at it, I don't really see any evidence of thinning hair or anything like that, but I'll take a closer look at your scalp too. So let me just take a quick look at your eyebrows, and then I'll look at your scalp as well and kind of see what's going on with your hair, okay? All right, so let me just take a quick peek. Yeah, so I see what you're saying. You're missing a lot of hair in the central portion of the eyebrows here, and then also laterally or out to the sides of the brows. It doesn't extend quite far enough. So what I do when I'm looking at your face, I'm looking at this upper triangle, sort of the brows out to the sides and then down to the nose. And the sides of your brows, aesthetically, your eyes are a little wider set apart, which is a good feature, but we want to enhance that a little bit by extending the brows out and creating a little more of a base. It's like an upside down triangle. That base of the triangle to be a little bit wider to accentuate the width of your eyebrows and your eyes as well. And then carry that down in a line to the sides of your nose so that everything creates sort of that appearance of a triangle. And that will really help with the symmetry and balance of your face, because the eyebrows really set the structure of your face and your eye shape. So we want to do something that matches really well and complements your eyes and the rest of your facial structure. Yeah, there's no evidence of hair loss or anything like that. This is all very normal appearing. So I think your hair that we borrow from the back of your head, it's taken somewhere about the area between your ears up here in the back of your head. That area I'll borrow there. The area is very small because it doesn't take many hairs to fill an eyebrow. Okay, so it's a very small area that I will remove hair, and you won't miss any of that hair. There will be no evidence of a bald spot or any kind of patchiness or anything back there. So once that part is done, you won't notice any evidence. Even if you lifted your hair to look for it, you wouldn't be able to see the area that the hair was removed from. So that's something that that I'm responsible for doing, so that you don't notice any evidence of any kind of hair loss. And I would be borrowing somewhere in the average of a few hundred hairs basically for each eyebrow. So it's not a significant amount of hair, because on average we have about 100,000 follicles on our head, and each follicle can have 1 to 4 hairs in it. So we have a lot of hair that we can use. So that's the hair loss issue that you were asking about is really not any kind of a concern. I'll draw in for you what I think would balance with your face, and then we'll kind of go from there. And you certainly have a say in what you like, of course. But the good news is, because you haven't tattooed or have any pigment on your brows, we can create a shape that's a little different than what you have, maybe a little higher arch, or if you want to go a little straighter across, we have the ability to do that and manipulate your brows in a certain way. And still look extremely natural. So then during the transplant part, after I've harvested the hair from the back, I make little tiny incisions into your brows. Little tiny incisions I use like magnifying lenses so that I can see and put them very close together. So I make the incisions in the middle, up and down like this, very parallel to the skin, so that when the hair grows out of the skin, it will grow just like your normal eyebrow hair. So they won't be growing. A lot of patients ask me, is it going to be growing off of my face? Absolutely not.
That's one thing I was concerned about. You know, they're just sticking straight out. And then what do you do?
Right. That is not a concern. The way that I place the hairs, they will grow very naturally and transition and follow the natural flow of your brows perfectly so that they look exactly like your eyebrows. And they will be your eyebrow hairs. They become your new eyebrow hairs, and they'll grow that way. Okay?
And how long does the procedure usually take?
The procedure for you, and on average, it can take anywhere from about 4 to 8 hours. But for you to fill in what you're looking to do, probably somewhere on 5 to 6 hour range. Okay. It's a very tedious process. First, we start with numbing in the back. I give you medication to relax you, like Valium and Norco, which is a pain medication. So
kind of nervous about that.
No, well, it helps to relax you for the day. So that way, you are nice and chill for the procedure. Then I do numbing injections when you're relaxed. I numb the eyebrows, and then after that, you don't feel anything. So most patients actually fall asleep and sleep through the rest of the procedure. So for you, I'm estimating about 5 to 6 hours to do a really nice, beautiful job for you. Then once they're transplanted, you can't touch that area for about 5 days. There's going to be ointment on the brows that you will leave the day of surgery, and you can't touch. Okay, and the reason is because those grafts are very delicate. Even if you barely brush them, you could pull them out. So you want to be very careful of that part. And then day 5, you can start gently washing the brows. There will be scabs that form around each individual hair follicle, so you'll have tons of little crusty scabs. Okay, so just keep that in mind if you have any events you want to plan around all of that. Overall downtime would be about 10 days before the scabs fall. And then at 10 days, you won't notice any evidence that anything was really done. Okay? And then the hairs themselves typically fall within 2 to 3 weeks after surgery. The ones that I transplant, your natural brows stay there, so you'll go back to looking just like this. And then 3 to 4 months later, you'll start seeing the hair growth in your brows. Okay. At that point, the hairs do grow like they're on your head. So when we're borrowing hair from your head and transplant them into your brow, they will grow long like they're on your head. So the only maintenance that you have to do is about once a week. I recommend brushing up on the brows and trimming across the top any of the longer hairs that have grown a little longer, and then you can brush those over and they'll blend very naturally with the rest of your brows. The good news is that it's your own hair. So it's 3-dimensional, it's hair, it's not a tattoo, it's not pigment on the skin that's 2-dimensional. So this actually looks, it's just like eyebrow hair.
And will it be most patients of yours? Are they like pretty bruised up after the procedure, swollen?
Most patients don't bruise. I've had a few. Some patients do bruise depending on, your history. If you know that you're an easy bruiser, then you're probably going to bruise a little bit around the eyes. So sometimes patients have a little bit of bruising around the eyebrows, can swell a little bit, but most patients really don't experience any bruising. A little bit of swelling is natural the day of the procedure and even a day or two after, which usually resolves after about 2 to 3 days. Okay. Pain-wise, patients feel maybe a little bit of soreness in the back. The eyebrows really are pain-free. The incisions are so superficial and the hair is so superficial that you really don't have any pain there. It's just in the back where the hairs are borrowed. And a lot of patients actually don't experience pain at all there either. Some have a little bit of soreness, take pain medication for maybe 24 hours, and then that's it. Okay. The incision itself, in order to get enough hairs, maybe 1.5 inches to 2 inches long at the most. So very, very small. And you'll never see that. It's a pencil thin line when it's all healed. And your hair, there's no missing hair. So. Okay. So what I need to do is let me just draw your eyebrows in for you, what I think we can achieve, and then you can tell me whether or not you like what you see or any ideas that you had for your own brows. Okay? So I'm going to hand you this mirror. What I want you to do is kind of point out the areas that bother you most there, and then I'll draw in the brows for you, and we'll go from there as far as, adding a little more of an arch or extending the brow a little bit further. Okay?
Yeah. So I would really want to add an arch and extend. So, and also fill in like the middle as well. I feel like it can be a little bit more dense.
Underneath here, on the underside here, or above?
I think it would be above. Just so I can get that arch.
A little more of an arch. Okay, so let's do that. I'll fill in a little bit there for you. And remember, this is just a pencil, right? We're just drawing it in, so it's not going to look like a drawn-in brow, but this is just to give us an idea. So starting with that, look at that. Is that kind of an arch that you're looking for, or you want to go a little higher, a little lower?
I think that's pretty good, actually.
Good? Okay. And then we can extend the brow out. And I like to measure the side of the eye to the side of the nose and end the brow within that triangle. So does that look like a good length for your brow? And then how about over here, as far as where you want to start your brow? Do you want to go a little closer to your nose? Would you like to see that, or do you like where it starts?
I like where it starts already.
Okay.
I feel like it starts pretty decent.
Okay. And then the day of surgery, of course, I'll take one brow and then be able to create the other one that matches this one. Okay, so we're going for sisters, not twins, right? Everybody says that we don't want twins, but as close as possible.
I mean, they're not even like sisters now, so I'm good with sisters.
There you go. So, but I really like that shape for you. That really actually accentuates your eye and makes your eye pop. And I love that. That looks really, really nice. So I think that would be a perfect shape for you with just a slight arch like that, nothing too accentuated. Right. And that width is really nice too.
Yes, I like that it's not too thick.
Yeah, yeah, it looks really good actually.
I really
looks great.
like it.
Yeah, great.
I do.
All right, we're all done. I want you to have a look.
Wow, it's crazy.
They look really nice.
Yeah.
It's gonna grow in perfectly.
I really like the shape.
Yeah. Yeah, the shape is gonna look really nice on you. It's gonna really accentuate your eyes once everything grows in.
Yeah.
Yeah, for sure. I'm really happy with how it came out.
Yeah, me too.
Okay, I'm really excited.
I am.
Good.
I am too. Thank you.
You're so welcome. So welcome. It's been my pleasure.